At Tendercare Gaylord, we're just dedicated to being able to help that person who's been struggling, who's now requiring a ventilator, to not lose hope, but to allow us to help get back on their feet again, get back as much of their wellness as we can.
We're the only ventilator-dependent care unit north of the 45th parallel, including the Upper Peninsula. We're 5 minutes off I-75. Sometimes people come to a place like Tendercare for short-term therapy so they can get strong and get out of here. And then we have other residents that do end up living here a little bit longer than they would choose for one reason or another. And that's really where our activities and our social services department engages with the resident and makes us a place to live, not just a place to come and stay, but we build resident-specific activities.
We have lots of activities here at Tendercare. They have arts and crafts, they have music that is just playing inside that we can go to. And just because you're on a ventilator, it does not make you stay in bed. You can get up and go to whatever you like.
Like the care is just unbelievable. They get you out of bed every day and try to give you therapy if you need the therapy. Whatever your needs are, you get here.
And that's really kind of where our therapy department comes in. We work with Genesis Rehab, and they are phenomenal getting people up and out of their chairs, out of their beds, walking, talking, eating, enjoying food, teaching them how to perform those activities of daily living so they can transition to the community a lot faster than they normally would be able to.
I was comatose basically when I first got here. Through the wonderful care that I've received here, look at me now. I'm up, I'm having a root beer float, I'm outside, it's beautiful.
The newer ventilators that we're using now provides people is amazing. They can get out of the building, they can go to the beach, they can go on color tours, they can go to Walmart, they can go shopping. We have a gentleman that just likes to go sit outside and enjoy the sun for a couple hours a day.
You're not enclosed here. If you want to go out and go to like a store or something, do some shopping, on the average about once a week I'm out and about, so I don't feel enclosed or anything like that here.
Well, the vent unit staff they're wonderful. They're well trained and they know exactly what to do. If there's ever emergency or an issue, they're right on it. They know what steps to take to help them, and the rest of the staff outside of the vent unit is just, they're wonderful. They help everybody out no matter what your need are.
We have the lowest return to hospital rate. It's largely because of Leslie Miller and her the programs that she's really developed.
She is just A1. She's kept me away from having pneumonias, because I was having them even at this other place. They said my lungs were too long, and I was getting them like every couple months, pneumonia. And here, I've been here for over a year, and I haven't had pneumonia once. So
We have incorporated some advanced therapy, some pulmonary therapy that can help reduce and sometimes avoid completely respiratory infections, such as the vest treatment, which wraps around the chest and helps to bring secretions up and out of the lungs more effectively, and the cough assist device, which allows us to also help enhance the lung capacity and volume and clear secretions and avoid secondary infections. Both of these therapies that we utilize are non-invasive and they're well tolerated by our patients, and they very much have impacted us in terms of reducing hospitalizations and reducing infections and allowing us to progress with weaning from the ventilators in many instances. The care that we provide here is going to help decrease those cycles, those sick cycles, and allow them to return to their best quality of life. And that's what the drive's worth. There's lots of centers that are probably closer to them, and that's of course good for visiting and making sure they're okay, but We say we're worth the drive because we have more advanced respiratory therapy, the knowledge, the equipment, and the ability to help their patients reach their goals, their family members.
When families choose a place to put their loved ones, a lot of times they'll pick someplace close, and that's for the family's convenience. When they come up and visit, they see the personalized attention that their loved ones get. They see the loving care that we treat their families with. We treat your family like our family.
We're a whole family here, you know. That's what's nice about it. We're a family. Once you're here, we're all family. So it's not like I'm a nurse and you're gonna do what I do. No, it doesn't work that way. So it's just a very good place to be.
These patients are our family here. We treat them just as we would if our mother and father were here. And that's what it's about. It's about treating others like we'd want to be treated. And that's the message that we want to give you. You know, if you choose us for your loved ones, you can guarantee that we will take very good care of them. And your goals are our goals. So if their goal is to stay here with us, they're our family. If their goal is to go home, then we try with everything we've got to make that happen, using all of our resources and reaching out to the community to get them back home. That's what it's about.